Hi there, and welcome to my website, Paul James Counselling. And today I want to talk about addiction struggles and recovery from addictions, and also habits, and just to sort of cover the different types of addictions that we might have. So when we think about addictions, the classic kind of addiction is to alcohol and drug use. You know, they're the most sort of common and thought about addictions. But also we have what's called process addictions. This might be gambling, this might be pornography addiction to certain food, and so there's different types. That's different to, say, alcohol and drugs, which is a substance, or food is a substance. Other addictions can be an act or something that we do that causes a certain reaction within us that we get addicted to. Most addictions and habits in the beginning felt quite good, otherwise we wouldn't get addicted to them. However, after time, it's harder to engage in these addictions without consequences starting. And for quite a while we might be able to, or try to, ignore these consequences in the hope that we can go back to the time when the addiction or the habit was working. But generally, an addiction is progressive, and it progressively gets worse, not better. In fact, it very rarely stays the same. If it's an actual addiction, or it very rarely stays the same, it will always kind of get worse with time. And the consequences get worse. The health implications get worse the longer we're in addiction for. And it can feel really scary because, you know, we can feel utterly powerless to stop ourselves from engaging in the addictive behaviour or taking a certain substance. And we can tell ourselves time and again, this time I'm going to stop, and then we end up going back to it. And it's really difficult. So I like to use the analogy of the waterfall. So if you imagine that's the water, and this is the waterfall, and this is the water pouring over the waterfall and down. So if you can imagine, if you're right on the tip of the waterfall, there's going to be a lot of pressure coming down to try and pull you down, right? And that's the addiction, and these are the cravings that take us back to the addiction or the habit. So when we come to therapy, or we go to groups to try and help with this addiction, we realize that this is a problem. We're right on the tip of the waterfall, so we've got the full force of the water. The water is the justifications, the cravings, the saying to ourselves, I just can't cope with life without this. I've had it for so long, you know, the denial, wanting to do it, and it's quite powerful. When we're stood, if you imagine standing right on the tip of a waterfall, it's going to be really hard, isn't it? And what we do with therapy is we help you step away from the waterfall. So at first it's going to be very difficult, and what a lot of people do that keeps them trapped in their addictions is they step away from the waterfall a little bit. So it's been a week or two, but they're still feeling the full force of the water, and they say to themselves, well, I've been clean, or I've not acted in my process addiction for quite a while, and I'm still miserable, I'm still feeling the full force of the addiction. What's the point? I might as well go back to it. And then the addiction kind of wins out, and we go back to the tip of the edge of the waterfall. Whereas actually what we can do in therapy is, when you're trying to step away from the waterfall, we can remind you on a weekly basis or a 2-weekly basis that the waterfall analogy is happening. To keep trudging away from the waterfall, we can challenge that faulty thinking that says life is going to be miserable without the addiction. This is life. If this is life without my substance or my process addiction, I don't want it, I'd go back. We challenge that while we're stepping away from the waterfall in therapy. And we remind ourselves that we're stepping away from the waterfall, and it's going to be difficult at first. Now here's the thing, all the therapy with myself, all of the groups, you can't evade the painful few weeks of stepping away from the waterfall to get to calmer water. I can't do that for you, but I can support you and remind you that we're going to calmer waters. I can pull you back when your head says you want to go into your addiction. I can pull you back into reality that actually you don't want to go into your addiction, and I can help support you with those difficult weeks when we're still feeling the full force of our waterfall. But I can't do it for you. There's no evading that painful bit. So if we can get you far enough away from the waterfall, from the cravings, from your addiction, we can then get you to calmer waters. If you think about when you do step away far enough from waterfall, you're in calmer waters. What does calmer waters mean? It means you've stepped away from your addiction or habit long enough that you're now in calmer waters, and you can see the truth of what was actually going on. You can see the truth of how the addiction was holding you back. You can see how it wasn't benefiting you. You can see how your mind is calmer. You can see how you're better now and your stress levels are down now. And when we're stepping away initially, another thing I'll remind people is, you can go and act out, but just acknowledge that you're going to be stepping right back to the waterfall. So just acknowledge that. Play the tape forward. I'm going to act out. I might feel some comfort initially, and then I'm going to feel shame. I'm going to feel remorse, and I'm not going to feel very good. So let's play the tape forward, which we'll do when we're pulling you away from the waterfall. And yeah, once we get there, we're back into reality a little bit, and then we've got the feelings that we were avoiding through our addictions to look at and to work through. That's where therapy can help. If we haven't stopped the addiction, all bets are off. There's no work to be had on feelings, trauma, because you're not in a place to work on yourself. So once we've stepped away from the waterfall and we've got ourselves away from the addiction, we can then look at feelings we're avoiding, trauma we might have. I do a lot of work with people with complex PTSD. Once we put the addiction down, we can see what comes up again in this supportive environment. Sometimes therapy isn't enough on its own, and I will suggest therapy groups or 12-step groups. 12-step groups particularly are very effective when trying to break an addiction, and sometimes just therapy isn't enough. You need support within the week in between sessions. Time will tell on that. We will work that out together on whether you need that. And sometimes we come in not knowing if we want to give up our addiction completely. We might not know if we have to go complete abstinent with alcohol. So what we do is, with curiosity, we can try that out. We can put boundaries in play, and see if you can do some controlled drinking. We will keep you safe while you're doing that. But we will look, if you can stick to the boundaries for quite a long time, maybe you don't need to stop completely. However, if you're continuing to break the boundaries that we set, it will be a clear-cut message that you can't stop on your own. And if it's drink, you might have to stop completely. But we will check that out while we're working together. So I've got a lot of experience working with addictions, and then working through the feelings after we've got you separated from the addiction, and maybe looking at any traumas that might be going on. So if you're struggling with an addiction or a habit, please do get in touch. I'll be happy to help. If you found this video helpful, please hit the subscribe underneath. That would be really great. And feel free to book a session in with me. I'll be happy to help you with your addictions. Take care for now. Bye.